Center Test Prep Exam Book. Question 1. Priapism is a urological emergency characterized by Option A, painful, prolonged erection, Option B, inability to void, Option C, testicular torsion, Option D, scrotal edema. The correct answer is Option A, painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 2. The most critical treatment for a patient with heat stroke is Option A, oral rehydration with electrolyte solution, Option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit, Option C, administration of antipyretics, Option D, active external rewarming. The correct answer is Option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Heat stroke is a life-threatening emergency defined by hypothermia, usually 40 degrees C/104 degree F, with CNS dysfunction. Immediate, aggressive cooling is the definitive treatment. Antipyretics are not effective. Question 3. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates Option A, normal cellular metabolism, Option B, hypoperfusion and anaerobic metabolism, Option C, kidney failure, Option D, liver failure. The correct answer is Option B, hypoperfusion and anaerobic metabolism. An elevated serum lactate, 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism, which is a key indicator of severe sepsis and septic shock. Question 4. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A, ESI level 1, Option B, ESI level 2, Option C, ESI level 3, Option D, ESI level 4. The correct answer is Option A, ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. An altered mental status with severe respiratory depression requires immediate intervention, making this a level 1, most acute. Question 5. In distributive shock, the primary pathophysiology is Option A, pump failure, Option B, widespread vasodilation and increased capillary permeability, Option C, fluid volume loss, Option D, obstruction of blood flow. The correct answer is Option B, widespread vasodilation and increased capillary permeability. Distributive shock, septic, anaphylactic, neurogenic, is characterized by profound vasodilation and maldistribution of blood flow, leading to a relative hypovolemia and decreased tissue perfusion despite normal or increased cardiac output. Question 6. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, ETCO2 of 0 mm Hg, Option B, persistent ETCO2 waveform with each ventilation, Option C, ETCO2 of 50 mm Hg, Option D, a flat line waveform. The correct answer is Option B, persistent ETCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 7. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression, Option B, dry skin and absent bowel sounds, Option C, hyperflexia, clonus, and agitation, Option D, bradycardia and hypotension. The correct answer is Option C, hyperflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperflexia, clonus, rigidity. Question 8. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 9. Murphy's sign is used to assess for: Option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Murphy's sign is elicited by palpating the right upper quadrant during inspiration. If the patient experiences sharp pain and abruptly stops inhaling, it suggests acute cholecystitis. Question 10. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because: Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 11. The golden hour for acute ischemic stroke refers to the window for: Option A, completion of an MRI. Option B, administration of fourth thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of fourth thrombolytics, TPA. The golden hour in stroke care refers to the critical importance of rapid assessment and treatment. For TPA is generally indicated within 3-4.5 hours of symptom onset in eligible patients. Question 12. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 13. A positive Koenig sign is suggestive of: Option A, cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Koenig's sign, pain and resistance with knee extension when the hip is flexed, and Brodzinski's sign are physical exam findings indicating meningeal irritation, often seen in meningitis or subarachnoid hemorrhage. Question 14. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, US citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 15. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms: tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 16. Hepatitis is primarily transmitted via option A, blood and body fluids, option B, fecal-oral route, option C, sexual contact, option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 17. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a stat CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 18. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, neurological status. Option B, renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Rhabdomyolysis involves the breakdown of muscle tissue, releasing myoglobin into the bloodstream. Myoglobin can precipitate in the renal tubules, causing acute kidney injury. Monitoring urine output and renal function is critical. Question 19. Lefort fractures are classifications of fractures of the option A, mandible, option B, midface and maxilla, option C, barbit, option D, nasal bones. The correct answer is option B, midface and maxilla. Lefort fractures are a classification system for fractures of the midface involving the maxilla and surrounding structures. Lefort I involves the maxilla, Lefort II is a pyramidal fracture, and Lefort III is craniofacial disjunction. Question 20. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids, option B, straining all urine, option C, pain management, option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 21. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways, option B, reduce alveolar surface tension and prevent atelectasis, option C, decrease pulmonary capillary permeability, option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 22. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate option A, no tetanus prophylaxis needed, option B, tetanus immunoglobulin only, option C, STEP or TD booster, option D, tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, STEP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a STEP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 23. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture, option B, papillary muscle rupture with mitral regurgitation, option C, pericarditis, option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture, a mechanical complication of ME. A VSD murmur is typically heard best at the left sternal border. Question 24. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma, option B, retinal detachment, option C, corneal abrasion, option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment. Question 25. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, miosis. This toxidrome is most likely caused by option A, anticholinergics, option B, sympathomimetics, option C, cholinergics, organophosphates, option D, opioids. The correct answer is option C, cholinergics, organophosphates. The classic sludge M, salivation, lacrimation, urination, defecation, GI upset, emesis, miosis, presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning.